For the thoracic extension pails and rails, you're going to need a foam roller or a yoga mat, something that you can extend your upper back over, and then you need an anchor point. So I'm going to use a kettlebell, but you can use anything that is not going to move or gives you enough weight to pull off of, essentially. Okay, so you're going to set your anchor above your head where you can reach up over the top. We're going to find the midpoint of your mid back. So for ladies, that's about where your bra strap crosses. For men, kind of right in the middle of the shoulder blades is kind of an ideal point to do this, but you can actually work a couple of different points, okay, depending on where you feel the most stiffness in terms of thoracic extension. Most important part here is that you keep your pelvis tucked under, so you are not compensating into the low back and extending from there. So keep the pelvis tucked under. You're going to reach up overhead and breathe easy. So from here, take some nice easy breaths. You're going to follow the pails and rails modality instructions, and that is going to be a 1 to 2 minute stretch, 10 to 15 second pull out of your stretch, okay, all isometrics, and then a 10-second pull deeper into your stretch. Okay, the only thing you are actually moving though is going further into your stretch as it's accessible to you on the regressive contraction. Okay, so we're gonna pretend that I've been here for 1 to 2 minutes, just relaxing, a nice mild to moderate stretch, pelvis stays tucked under. Okay, after that, I'm going to hang on tight to that kettlebell and I'm going to try and sit up. Okay, one thing you may need is a block underneath your head. Okay, if letting your head fall back is not comfortable for you, then you can go ahead and put a yoga block or something to support it underneath here so it's not so cranked back. If it feels okay, then that's fine for you. So after your stretch, you're going to tuck the pelvis. You're going to try and do a crunch up, essentially, okay, with holding onto this kettlebell. It's an isometric crunch, so you're not actually going anywhere, but you should be feeling the pull from here, not from the arms. So you're not pulling with your arms up, you're trying to do a crunch up. Okay, so as you pull, slowly ramp up into intensity. So you're 10%, 20, 30, 40, and you may feel a little tension here. That's okay. If that's too much, you can tuck this tighter into you and do your crunch from there. Breathing, okay, ramping up 20 to 80%, whatever is comfortable for you. Okay, after that hold, then you're going to, after you get to your max capacity, you're gonna hold for 10 to 15 seconds. Okay, the higher you get in percentage, the less time you're going to be able to hold at that percentage. Make sure you're breathing through this. Try and keep the pressure consistent. Come back down if you feel like it's getting too intense, okay? So after you've held for 10 seconds, doing your crunch up at that intensity, you're going to relax, take a breath, make sure the pelvis is still tucked, and then you're going to try and pull yourself with your hands as well as your spine, okay, deeper into the stretch. So if you are able to walk your hands down, you should be feeling your mid-back muscles contracting, pulling you deeper into that position, okay? You're gonna hold that for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, and here, you should have found yourself deeper into the stretch than when you started for multiple reasons, but because you're pulling yourself into there. Okay, so that was round 1. Ideally, you would do 1 to 2 more rounds, okay, for a total of 2 to 3 rounds. But this can be intense, especially for the mid-back. So if you find that you need to relax out of it, then 1, you can lessen the intensity of it. You can get something softer or not so big to extend over, okay? Or you can relax out of it and potentially go back into it as long as you're not having pain. So slowly ramp up into these, make sure your core is controlled. This can be an intense maneuver, especially with the head being back. Support the head if needed and moderate the intensity that you're using.